What do you think the link might be between these people? I'll give you a second. They're all men. See if you can come up with an answer. The next slide will give everyone the answer to this. So they've all got prostate cancer. So a lot of famous names in there. And Chris Hoy was one of those names, as I referred to when we started off the evening. So I'm going to be speaking about prostate cancer as well. So next slide. So it is a sadly common cancer, but again, we've got a reasonably good success rate in picking up prostate cancer early. So again, we're wanting you to be well informed about what those things are that you should be looking for. So the prostate is a small gland sitting at the neck of the bladder. Just as the urine comes out through what's called the urethra, there's a small gland sitting there, and that's the prostate. So the prostate makes hormones and semen. So risk factors for prostate cancer are getting older, age. So as you get older, prostate cancer becomes more common. Having a family history. Now, a number of us have said that, haven't we? So if you've got someone in the family who's got a particular sort of cancer, then it's important for you to know about it. And indeed, if you've got a brother or a father who's had prostate cancer, increasingly these days, they may well be having some genetic testing to see whether they've got a genetic factor which may put you at even a higher risk of having prostate cancer, which is worth you knowing about. Ethnicity. So we know that Black African men have got a higher risk of this than other ethnicities. So again, worth you being aware. Symptoms. Now, some people don't have any symptoms, but these are the symptoms which you would need to be aware of. Urinating more frequently, or maybe having a poor urinary flow, so a weaker sort of stream. Blood in the urine, blood in the semen. Erectile problems. Difficulty urinating, so maybe having to stand there or sit there for a while before urine comes out. Pain can be a sign of this for people who are getting secondaries, and prostate cancer secondaries tend to be in the bone. So of course, most people with aches and pains in their joints don't have prostate cancer, but it's one of the things that's worth being aware of if you've also got some other things. Burning when urinating can be a sign of infection, but also sometimes as a sign of cancer. Painful ejaculation is worth knowing about. So all of these things can be signs of prostate cancer. The trouble, of course, is that a lot of those things can be signs of other things too. So if these are symptoms which you're developing, it's worth coming to see one of us, your GPs, to speak about it. Now, briefly, it's also worth being aware that the prostate gland itself, in all of us, will get slowly bigger as we get older. So something called benign prostatic hypertrophy, or just the fact that prostate gets bigger in a benign way, non-cancerous. And actually this benign prostate condition will often cause a lot of these other symptoms too, particularly the frequent urination, the difficulty urinating sometimes, getting up at night. So again, it can be a tricky thing to pick up, but something which happens maybe in a more rapid way. If you're getting symptoms that are coming on quicker, that's the time to get these things checked out. Next slide, please. What should you do next? Well, as I say, come to see your GP about it. Many of the people who've got symptoms in that list don't have cancer. So I know sometimes it can be worrying, stressful to come to the doctor when you've got cancer in your mind. Do mention it to us if you're worried about cancer. We really want to hear it. We're not going to be we're not going to judge or be upset or think it's silly. I promise. We really want to hear you. If you're worried about that, come and see us. The next thing we'll do will be to do two things: a PSA blood test, which I'll come on to, and a rectal examination. That means a finger in your back passage to feel the gland. And both of those things are important because one on their own is not always a good enough test for prostate cancer. Next point, should everyone be tested? Is there a screening program? No, is the short answer. There isn't. We've heard about screening programs and how good they are, cervical cancer particularly, but also breast cancer, bowel cancer, lung cancer, which is coming. So really, we prostate cancer, it would be great if we had a screening program, but sadly we don't. And why is that? It's because really we don't have a good enough test which is reliable enough, picks up cancer in a way that it is reliable, but it doesn't pick up lots of other things. So that's why there's real challenge around screening, and there's a number of different areas of research where screening is being looked at. So we're hoping that screening may be a possibility in the future. But if you're someone who's got those risk factors, so the family history, perhaps the ethnicity, which puts you at a high risk, or new symptoms that you're concerned about, then come and speak to us about it. PSA almost certainly would be one of the things we'll want to do. And then you may well be someone who will have a kind of a regular PSA test for us to keep an eye on things. But there isn't a national screening program that we can use. So that's something that has to be done between you and your doctor to look at your personal circumstances, to decide how often that might need to be done, and what in a way what your personal screening program might need to be, and that varies. Next slide, please. Okay, so what do I do if you have an abnormal PSA? We will refer you into the hospital, and that's done in a special kind of rapid way. So all of these different cancers that we've discussed this evening, if there are things which concern us and we want cancer to be investigated as a possibility, we refer into specialists under a special 2-week pathway, and that means you'll be seen within 2 weeks of us referring you in to get seen by the relevant specialist and get this urgently tested. And that's great. And we've got a really very good local hospital who responds to these referrals within the 2 weeks at a very, very high proportion of the time. So you will get seen quickly. We've all read about and seen long waits for lots of things in the NHS at the moment, but cancer is still seen within 2 weeks. So for this prostate, you'll be referred to see a urologist. They'll do an MRI scan. They'll likely do they may do a biopsy. And then there's other testing to look at stages, a bit like the other cancers that have been discussed, and then other treatment based on that. Surveillance may be one of the things that's done then. If you've got a low-grade cancer that we're not so concerned about, it may just be that you're monitored. Next slide. Last slide. And again, prostate cancer is a good news story in terms of outcomes for many people with prostate cancer. Stage 1, 2, and 3, which is when prostate cancer is defined, is just within the prostate. Survival at 5 years is really very high. Stage 4 is when it's spread to distant parts of the body. Even then, when you've got advanced prostate cancer, 50% survival at 5 years. It's even in that more advanced state, it's not quite as bad as some of the other cancers we've discussed today.